Miss Ashley. How are you doing?
Hi, good.
So my name is Jackie. I'll be discharging you today, okay?
Okay.
But before we get you discharged, I want to give you some discharge instructions, and we'll go over those. I
Okay.
just want to make sure that you know that in a couple weeks you do have a follow-up appointment, and you're gonna attend that, right?
Yes.
All right. Do you have any questions for me?
I actually do have a couple of questions. So, the first question that I was kind of, I was concerned about because I wasn't sure is how long should I expect to bleed for?
So you should be expected to bleed for up to 6 weeks, okay? And so you'll have dark red bleeding the first couple of days, and it should lighten up throughout those 6 weeks, okay? So the first day to the 4th day, you'll typically have dark red, and then from the 4th to the 10th, you'll have pinkish brownish discharge. And then after that, you'll have yellow-white discharge up to 6 weeks, okay?
Okay, does it have to be the full up to 6 weeks?
Yes, it's usually up to 6 weeks.
Okay.
But if it goes from yellow-white back to dark red, make sure you call us, okay?
Okay.
Alright, and then just make sure you do change your pads frequently, and you're performing hand washing before changing your pad and after changing the pads, okay?
Okay. So, I had a question about that too. So, how long do I have to change my pad? Like, what's the time frame? Do I have to change it like very often? Every hour?
You typically change it every 2 to 4 hours.
Okay.
But if you're having to change your pad every hour and you're having large clots, let us know, okay?
Okay.
Because you shouldn't be saturating your pad within 1 hour.
Okay. And also, will it have like a smell to it?
It'll have a bloody tinge smell, but if you have a foul odor smell, also let us know about that, because that could indicate infection,
Okay.
as well as a fever too.
Oh, okay. And another thing, this is my first time wearing pads. I never wear pads. I usually wear tampons. What do you recommend on that?
So I wouldn't necessarily recommend tampons. Tampons do increase the risk of infection. So infection would be the smell, foul odor, or
Okay.
even fever, and this can lead to endometritis or even sepsis. So just make sure to use pads for a couple weeks, okay?
Okay. And then I did have another question. So, can you explain to me how the blood flow should be again? Can you and the amount and color?
So it'll be dark red
Okay.
from 1 to 4 days, and then pink brown on the 4th to 10th day, and then yellow to white on the 10th to 6 weeks. Okay.
Okay.
And it shouldn't be too much. You shouldn't have large clots. The large clots would be considered like an egg size or even a golf ball size. Okay. So anything smaller than that is good. Is okay. But you don't want anything bigger than that. Okay.
Okay. Perfect. Sounds good.
All right. Do you have any questions about baby?
I do have a couple of questions for baby.
Okay.
Or about baby. So my whole thing is his umbilical cord. I'm not really sure how to care for that.
Okay, so before he is discharged, we actually do take off his clamp, which I'll check if they've done it yet, but I believe they have. So for the umbilical cord, you'll keep the stump clean and dry. You don't really want to submerge it underwater or anything like that. You don't want to bathe him just yet. Maybe a couple sponge baths, but not submerging him, okay?
Okay.
You'll just kind of clean around the stump with a little towel, just clean it, and then pat it dry, okay?
Okay.
The diapers, and we'll look real quick. So they did take his cord stump off, the clamp, I'm sorry. And his diaper, whenever you change his diapers, just make sure it's tucked underneath so it doesn't cause any rubbing, okay?
Okay.
And so like I said, you'll just kind of tap around his cord with just a clean little washcloth.
Okay.
Pat dry, and then just tuck it underneath. Okay? And that
Okay.
should fall off within 3 weeks of age, okay? So it should be
Okay.
before that. Do not pull on it, even if it's hanging there by a piece of little thread. Do not pull it off. It'll
Okay.
fall off by itself, and you might expect a little bit of bleeding, not much, but that will be normal after it falls off. Okay.
Okay.
Let's see, what else would he? Don't apply any alcohol or any treatment on it. So,
Oh, okay.
so try not to get it wet with anything else, okay? If it has any foul odor or yellow discharge, call your provider, okay? Or the
Okay.
baby's provider, okay?
Okay.
And if it's red, the stump of the area is red, let us know. As well, if he cries when you touch the cord or the skin around it, okay, because that may indicate infection.
Okay.
And if the stump doesn't fall off after 3 weeks, let us know, okay?
Okay.
All right. Is there anything else?
I think that's all.